Ben Eddie, merhaba.
Dora is 6 months old. His mother, Nagihan Dede, was visiting her family in Turkey when she found out she was pregnant with her son. Then the coronavirus pandemic broke out and she was stranded in Istanbul for months.
Hiç dışarı çıkamadık. Sadece doktor kontrolü.
We never got out. I just went to see my doctors because we didn't know what the disease was.
She returned to the US, and in October, 5 months after returning from Turkey, Dora was born. Within weeks, the US began its vaccine campaign, and Dede, who was breastfeeding, began looking into whether the vaccines were safe for her and her child.
Kendi doktoruma da danıştım. Doktorum bana
I consulted my doctor, and my doctor told me that I also passed the vaccine benefits to my child through breastfeeding and that it was protecting him as well.
A joint study by Harvard University and Massachusetts General Hospital suggests mothers are passing on COVID-19 antibodies to their babies. The study included 131 women, 84 of them pregnant, 31 breastfeeding, and 16 neither pregnant nor breastfeeding. The research found that vaccine antibodies passed on to the babies before and after birth through the umbilical cord or breast milk.
Individuals that has been vaccinated and they are breastfeeding, they provide a more robust immune protective response to the infant versus if you've been naturally infected with COVID-19.
Dr. Sira Madad is an infectious diseases expert featured on a Netflix documentary called Pandemic: How to Prevent an Outbreak. She is also a breastfeeding mother.
While I was breastfeeding my now 1-year-old, I actually decided months ago that I would pump and give the breast milk to my 5 and 7-year-old in their milk, just to pass on those antibodies and that protective benefits.
Some parents worry that the breast milk of a vaccinated mother can be harmful to the baby. But according to the CDC, these vaccines are not believed to be a risk to lactating people or their breastfeeding babies. And the U.S. Health Agency says reports show antibodies in the breast milk may help protect babies, although more data is needed to determine what protections these antibodies may provide.
So you're not going to find the virus in the breast milk. You're going to find the antibodies, the protective antibodies instead. And so it's important just to understand how the mechanism and the biological plausibility of any dangers pose, and there is no dangers pose in that regard. And
Doctors hope this is good news for mothers like Nagihan Dede, who want to ensure they and their children are protected from the virus. Dilge Timochin, VOA News, Washington.
Evet anneciğim, aferin sana. Aferin.